If you're over 50 and you keep waking up at night to pee, this video could change your life. If you've ever felt the frustration of getting up 2, 3, or more times to use the bathroom, or the pressure of sudden urgency that makes you dash for the restroom, you're not imagining it, and it's not always just getting older. Today, we're talking about 9 foods that could inflame your prostate. Avoid them after turning 50. I'm Dr. Camila Vega, and for more than 15 years, I've worked with men who come in exhausted, embarrassed, and desperate for changes that actually improve their daily life. In this video, I'll explain the 9 common food groups that can make lower urinary tract symptoms worse, why they do it, what the evidence says, and practical swaps you can start using today. Stay with me, and if you want to see a step-by-step pelvic floor exercise routine I'm making next, subscribe now so you don't miss it. 1. Coffee and other high-caffeine drinks. Caffeine is a stimulant not only for your brain, but for the bladder. It increases bladder muscle, detrusor, activity, and acts like a mild diuretic, so you get more urine and more bladder contractions. Clinically, I see men who cut afternoon and evening coffee notice fewer nighttime trips within a week or two. A study found that men who consumed more than 200 milligrams of caffeine per day, roughly the equivalent of 2 cups of regular coffee, had 72% more urinary urgency. That's an association, not proof of cause, but it aligns with what many patients report. Practical guidance: if you drink multiple cups a day, try shifting all caffeine to the morning and avoid it after mid-afternoon. Swap 1 cup for decaf or try green tea, lower caffeine, and it has other potential benefits. If you're very sensitive, replace late-day coffee with warm water, herbal tea, or a small decaffeinated coffee. 2. Spicy and acidic foods. Hot peppers, hot sauces, tomatoes eaten in large amounts, citrus concentrated shortly before bed, these can irritate the bladder lining in sensitive people. Capsaicin, the compound that makes chilies hot, and dietary acids can stimulate bladder nerves and heighten the feeling of urgency or burning during urination. Many men tell me salsa or extra hot wings make their symptoms flare that night. Practical guidance: notice your personal triggers. Reduce or remove spicy condiments in the evening and replace them with milder flavorings like fresh herbs, lemon zest in small amounts, if tolerated, or avocado-based sauces. If you love spicy foods, aim to have them during the day rather than within a few hours of bedtime. 3. Processed red meats, sausage, bacon, hot dogs. Processed meats are typically high in saturated fat, sodium, and additives like nitrates. These factors contribute to systemic inflammation and oxidative stress, mechanisms that can worsen prostatic inflammation or promote prostate enlargement over time. I don't recommend eliminating gluten unless you have symptoms or tests suggesting sensitivity. But for some men, reducing wheat-based products leads to noticeable improvement in discomfort and urgency. Practical guidance: if you suspect gluten sensitivity, bloating, diarrhea, weight loss, or unexplained fatigue along with urinary symptoms, discuss testing with your provider. Try a short monitored trial of reducing gluten-containing foods, such as wheat bread, pastries, and some processed foods, and replace them with whole grains like brown rice, quinoa, corn tortillas, or certified gluten-free options. Always avoid self-diagnosing celiac disease by starting a gluten-free diet before testing. 7. Saturated fats. Butter, full-fat dairy, fatty cuts of meat. Diets high in saturated fats encourage the body to produce inflammatory mediators and may affect hormone balance. Over years, this metabolic environment can favor prostatic growth or a more inflamed state. Observational studies point to higher saturated fat intake correlating with worse prostate health in some populations. Clinically, patients who adopt a Mediterranean-style diet, richer in unsaturated fats like olive oil and nuts, often report overall health improvements and sometimes reduced urinary bother. Practical guidance. Replace butter and heavy cream with olive oil or avocado oil for cooking. Choose low-fat or moderate-fat dairy options if tolerated, and favor fish, salmon, mackerel, or sardines for healthy fats. Swap fatty cuts of beef for leaner options or plant proteins several times per week. 8. Artificial sweeteners. Artificial sweeteners are common in diet sodas and low-calorie packaged foods. For some individuals, they can irritate the bladder or increase urinary frequency. There's variability in sensitivity. Some men notice a clear flare after diet soda, while others tolerate them fine. In the clinic, when patients cut artificial sweeteners and replaced them with water or unsweetened tea, many described less urgency and fewer leaks. Practical guidance: if you regularly consume diet sodas or products with sucralose, aspartame, saccharin, or other non-nutritive sweeteners, test a short elimination for 1 to 2 weeks. Replace them with sparkling water, plain water with citrus, or lightly sweetened beverages using small amounts of natural sweeteners if needed. Read labels. Artificial sweeteners hide in many packaged foods. 9. Excessive calcium intake, especially from supplements. Calcium is important for bone health, but some large observational studies have associated very high calcium intake, particularly from supplements, with increased risk of prostate enlargement. One major cohort, the Health Professionals Follow-up Study, reported that men consuming more than 2,000 milligrams of calcium per day had about a 25% higher risk of advanced prostate outcomes compared with men consuming normal amounts. That doesn't mean calcium is bad for everyone, but extremely high intake, especially from pills rather than food, may carry risk. Practical guidance. Aim for balanced calcium from dietary sources like dairy, if tolerated, leafy greens, and fortified foods, rather than large supplemental doses unless prescribed by your physician. If you take calcium supplements, review the dose with your healthcare provider and consider whether dietary adjustments could meet your needs. Remember, this finding is an association and should be interpreted in context with your overall bone and cardiovascular health. A few quick science notes and bedside reality. You may have noticed recurring themes. Bladder irritants like caffeine, alcohol, spicy foods cause more immediate symptoms, whereas dietary patterns that promote inflammation and metabolic dysfunction, processed meats, refined sugars, saturated fats, and excessive calcium supplements contribute over months to years. The numbers I mentioned, greater than 200 milligrams caffeine per day, linked to 72% more urinary urgency, and greater than 2,000 milligrams calcium per day, linked to a 25% higher risk in the HPFS, are from epidemiological studies that show associations. In the clinic, these patterns match what I see. When men change habits gradually, many notice meaningful relief in their daily life. What to eat instead? A practical, prostate-friendly approach. You don't need a perfect diet to get better. Small, consistent changes matter more than drastic one-day flips. Focus on adding more of these foods. Fatty fish 2 to 3 times a week, salmon, sardines, mackerel for omega-3s, colorful vegetables, especially cruciferous vegetables, broccoli, cauliflower, and cooked tomatoes for lycopene, legumes and beans as protein sources and fiber, which support healthy weight and metabolic balance. Nuts and seeds. Pumpkin seeds are a popular nutrient-dense snack some men find especially supportive. Olive oil as the main cooking fat, green tea in moderation, lower caffeine than coffee and rich in antioxidants, whole grains unless you are gluten sensitive, brown rice, oats, quinoa. Plenty of water. Staying hydrated reduces concentrated urine that can irritate the bladder. Aim for consistent hydration across the day and reduce fluid intake 1 to 2 hours before bed if nocturia is a problem. Lifestyle measures that amplify diet changes. Diet is only part of the picture. Lifestyle habits strongly influence prostate-related symptoms and overall well-being. Maintain or reach a healthy weight. Excess weight, especially central adiposity, drives inflammation and hormone changes that can worsen LUTS. Exercise regularly. Aerobic activity and strength work both improve insulin sensitivity and circulation. Men who exercise consistently report fewer urinary complaints. Pelvic floor exercises. These improve control and can reduce urgency and leakage. I'm preparing a focused video on step-by-step pelvic floor training. Subscribe so you don't miss it. Prioritize good sleep and reduce evening fluid intake to improve nocturia. Manage stress. Stress can make urgency feel worse by heightening sympathetic nervous system activity. Mindfulness, breathing exercises, and moderate exercise help. Avoid smoking. Tobacco increases inflammation and can make urinary symptoms worse. A practical plan you can start today. Pick one small change and make it routine for 2 weeks. Here's a simple starter plan. Week 1, cut caffeinated beverages after 2 p.m. and swap late-day coffee for decaf or herbal tea. Week 2, replace one processed meat meal with fish or legumes and add a daily serving of vegetables. Week 3, try eliminating artificial sweeteners and one sugar-sweetened drink each day, replacing with water or sparkling water. Track your symptoms in a notebook or on your phone, how many times you wake at night, episodes of urgency, and any burning or pain. Small wins are motivating, and if you don't notice change, that information is valuable to share with your clinician. When to see your doctor. These dietary approaches can reduce bothersome symptoms for many men, but they are not a substitute for medical evaluation. See your healthcare provider if you have blood in the urine, severe pain, sudden inability to urinate, fever with urinary symptoms, or if symptoms persist or worsen despite lifestyle changes. Also, check with your clinician before stopping or starting high-dose supplements or making major changes if you have other medical conditions. Recap, the 1-minute summary. You came here for 9 foods that could inflame your prostate. Avoid them after turning 50. The 9 groups to be mindful of are caffeine, spicy and acidic foods, processed red meats, alcohol, refined sugar, gluten in sensitive individuals, saturated fats, artificial sweeteners, and excessive calcium supplementation. Each can worsen urinary symptoms through bladder irritation, diuresis, inflammation, hormonal effects, or metabolic disruption. Replace and reduce slowly. Choose fish, vegetables, legumes, olive oil, pumpkin seeds, and green tea. Get moving, manage weight, and practice pelvic floor exercises. Final practical action. Today's first actionable step. If you're drinking coffee in the late afternoon or evening, skip it for 1 week and see how your nights change. If you'd like a guided checklist to help you implement these swaps with shopping tips and a 2-week plan, download the free prostate-friendly checklist in the description. And if you want guided pelvic floor exercises next, subscribe now so you'll be notified when I release that video. You're not alone in this, and small, thoughtful changes can lead to real improvements in sleep, comfort, and confidence. If symptoms are persistent or worrying, please consult your healthcare provider for evaluation and tailored care. Take one small step today, and be gentle with yourself as you make changes. I'll be here to guide you through the rest.